Welcome to GW Integrative Medicine, the podcast about disease prevention and health promotion from the Office of Integrative Medicine and Health at the George Washington University School of Medicine and Health Sciences.
I'm Dr. Lee Frame, Director of the Integrative Medicine Programs here at GW.
And I'm Janet Rodriguez, the office's Administrative Director. Today we're talking to Kaylan Baban MD, MPH, the inaugural Chief Wellness Officer for GW Hospital, GW Medical Faculty Associates, and the GW School of Medicine and Health Sciences.
An assistant professor of medicine here at GW, Dr. Baban leads the GWell Center for Healthcare Professionals. She's also the director of the Lifestyle Medicine Program at GW Medical Faculty Associates.
Welcome to the podcast, Dr. Baban.
Thank you very much. It's my pleasure to be here.
Yeah, we're glad to have you as well. We know a lot about all the wonderful things that you're doing, but our listeners don't. So we're hoping you can help fill them in, starting with what is the GWell Center for Healthcare Professionals?
Okay. So as you've described, the GWell Center for Healthcare Professionals is a reasonably new institution or office here at GW. And what it is really is the office through which we're organizing all of our wellness initiatives for our medical enterprise. So that's for our School of Medicine and Health Sciences, for the hospital, for our medical faculty practice. And to that end, what we're really looking to do is to have some kind of an organized framework, an organized umbrella through which we can make sure that we are aware of all of the resources that are available and making all the members of our community available of those resources, aware of those resources. We want to make sure that we are identifying where there are needs that are not yet met and providing a framework to create those. And also that we have the chance to really bring together some folks who are all across the institution who are doing really terrific work in these areas that may not otherwise know one another, so that we can develop the best wellness initiatives and kind of tightest community around this that we can.
Fantastic. Yeah, that's a really good point. I think we hear that a lot in academia, that people are doing great things across the university and then it doesn't seem to interconnect. We work in our silos. So I think that's, for me, one of the important things about what you're doing as well is bringing what's already being done together, but then you're also adding all these new elements as well.
I think it is an incredibly important area. And as you say, Lee, it is very common for us to end up seeing that there are people doing fantastic work that may relate beautifully and maybe in a really complementary way to work that someone else is doing in another corner of the institution, and they may not be aware of it. So one of the things that I was very conscious of when stepping into this role was that we already have a lot of people who are doing fabulous things in wellness at GW. It was really a question of being able to provide a home and a structure for that work so that those people could find each other and we could work together in a collaborative way that really would be intentional rather than kind of isolated one-offs.
Excellent. So one of the elements that you've brought together is the Wellness Advisory Board. What is it and what role is it playing in the center?
So I am very grateful that we have had some really terrific folks come and volunteer their time to be part of our Wellness Advisory Board. So this is a group that meets on a bi-monthly basis. I am very pleased to have you, Dr. Frame, as one of the members of the Wellness Advisory Board. And these are individuals from across the institution. So across members of the hospital, of the faculty, medical faculty associates, and of the School of Medicine and Health Sciences. So we have representation from all three of those member organizations. And we have representation from all of the various levels of those organizations. So the populations that we have a mandate at the GWell Center to represent are really all of the members of this community. So these are our graduate medical and health sciences students, our residents and postdoctoral fellows, our undergraduate medical students, faculty, advanced care practitioners, nurses and other clinical staff, non-clinical staff, and our alumni. So we are really seeking to reach all of the members of this community, which makes us unique in my experience and to my knowledge among academic medical centers in the United States. Most of the wellness programs and most of the CWOs who I know at other academic medical centers, their work is really focused specifically on providers and providers in training. Mm-hmm. And we can speak about that a little bit more and why I think it's really incredibly important and a feature of the program that we have here, that we have taken a much more inclusive approach to defining the community that we're serving.
So one of the important aspects for me that you're doing with the center is creating a culture of wellness and taking this more holistic approach, like you're saying, including everyone rather than simply healthcare providers and training. But that's a big task. How do you go about creating a culture of wellness?
Yes, it is a big task. And I think it is really foundational to any further work that we do that needs to build on this. So creating a culture of wellness is something that I think really does begin with this question of who are we including as members of that culture. The reason that I think it is so critically important that we have broadly defined our population as broadly as possible, it really gets to this question. So we can imagine in a program where our initiatives were really focused just on a subset of our population, you can imagine that would mean that there would be resources available for that population, and maybe there would be a conversation taking place in an ideal world amongst members of that population in a positive way surrounding supporting wellness. However, if it's really just a subset of our community, what that ends up meaning is that the concepts of wellness, those resources, they don't end up permeating. And we are still going to have members of our community who are not getting the support and resources and dialogue around wellness that they need and deserve. That feels to me like a constant uphill battle where you're really setting a limit to how far wellness can permeate into your community. And that seems to really limit what we're able to accomplish. We are interacting all day long, those of us who are providers, with individuals who are not providers, who are still playing a really important role in this organization. We have consciously called the GWell Center the Center for Healthcare Professionals, not with the idea of being exclusionary, but with the idea that this is a healthcare organization, and everyone who works here, regardless of what role they are in, whether they are, the chief of a clinical division, whether they are front desk staff, whether they are working in the billing department, whether they are organizing student electives. Every one of these individuals has a role that is critical to supporting this organization's mission. And therefore, we are defining healthcare professionals broadly, and we are opening our community and our community initiatives to be as wide as possible so that we really can start to affect culture throughout the organization in a real way rather than keeping that limited to one corner. So to that end, to really build this culture of wellness at GW, the members of the Wellness Advisory Board have developed a set of goals that are part of our mission. And so we want to embrace and promote a broad concept of wellness, recognizing that as a foundation of really high quality self-care and of professional excellence. I think this is really important. We can come back to that. We want to, as I've mentioned previously, make sure that we are working on providing resources where necessary. Those resources would be in part to support the development of skills and the socialization of resources so that everyone is aware of what the available resources are and how they can take advantage of them to really most effectively pursue their own personal and professional wellness. And we want to be able to provide leadership. We recognize that when we're speaking about wellness, particularly in the setting of a healthcare environment, that there are important steps that individuals can take, and that some individual responsibility here is really important regardless of the setting, but that we are working in a particularly high-stress environment in some ways that are what's sometimes called necessary stress, that it's going to be hard for us to avoid just by virtue of the nature of the types of work that we're doing. But in some ways, things that perhaps we can mitigate with some appropriate leadership. And so those are the roles that we're trying to meet and that we have set as our mission. And so the ways in which we're doing that, you can imagine, sort of flow from that idea of mission. Some of the initiatives that we're working on now that I'm really excited about have had to do with kind of building on our early work of just evaluating what resources are out there and available and bringing those together, but now starting to fill in some of the gaps. So we had identified that having a structured course for provider self-care was a really important need that was not being addressed yet in a really in a kind of structured manner that would allow access to all members of our community. So we did launch a provider self-care course this fall with your support, Lee,
Mm-hmm.
and that course was extremely well received and has served now as a pilot in what we're hoping to develop further into a course that will be available not just to all of our graduate students across the community, but also really to all members of our community. And perhaps be able to expand a little bit more broadly outside GW in the future. But we want to make sure that we're starting with our folks to make sure that everyone knows that they have access to this resource and can feel supported in a way that we have received feedback has been really meaningful and helpful for the individuals who did partake in the course this fall.
That's right. One of my students actually, the following term, went through a difficult period in her life. Her father had some serious illnesses, and she actually wrote to me saying that she utilized what she learned in this course and that she knows it made a difference in her ability to handle going through this tough time while balancing work and her graduate work and the rest of her family.
So that means so much to hear that, and we hope that that everyone will be able to avoid these kinds of life experiences as much as possible. But we know that this is just something that happens in life that we will often end up running into in tough times. And knowing that we have the resources and experience and tools available to use, that we don't need to just figure things out on the fly, I think really can make a huge difference. And it's terrific to hear that we were able to help support her.
Yeah, absolutely. Already making a difference.
Was that part of the WRAP program or WRAP plan? Or have you launched that already? I'm not sure.
Great. Thank you for asking. So I think you're referring to our Wellness and Resilience Action Plan that we refer to as our WRAP. So the WRAP is a worksheet actually that I had developed several years ago that we've been using as part of our core curriculum in the medical school for several years now, in which we ask our students at that time to really take stock of where they are across 7 different spheres of wellness. And this is a slight adaptation from the SAMHSA model of 8 dimensions of wellness, the Substance Abuse and Mental Health Services Administration. They've developed this model that's very broad concept, really broadly defines wellness, and actually takes an approach that dovetails with one of my areas of specialty, which is lifestyle medicine, to really be very holistic in the way that we're thinking about wellness. So not just physical health, emotional health, but also spiritual health, social health, social wellness. So what does the individual's social network look like? Financial wellness, intellectual and occupational, which at GW we've collapsed into one, but can certainly be separated out as SAMHSA has done, and environmental. So the WRAP sheet, the Wellness and Resilience Action Plan, we've asked first students in the School of Medicine to complete this form and really take stock of what their priorities are in each of those dimensions of wellness, where they believe they are now in relation to where they would ideally like to be, or in relation to that priority. And to then assess where they think it is reasonable, and abbreviating this process a little bit, but after taking stock in that way, to then assess where they think it would be most appropriate and realistic for them to be setting one very specific SMART goal for the coming academic year. With the idea of continuing to check in on that and iterate on it over the course of the year, recognizing that whatever they are doing to support their personal wellness is going to be really critical to them being at their professional best. So we started using this in the School of Medicine and have now actually been able to use it also with some of our health sciences graduate students, also in the provider self-care course, as well as some of our faculty workshops, and are actually in the process of discussing having this rolled out as part of the annual review for residents and faculty, and perhaps also for staff. So it's been really well received, and I think the feedback that we've gotten the most has been that it feels to individuals who've completed it as though they have they've had an opportunity to really think intentionally about their wellness and the things that are important to them. And then they kind of walk away with something that's actionable.
Right. And making that part of the annual review process will assure that everyone takes that time, because sometimes that's the hardest part, is just setting aside time to do something like the WRAP worksheet, even though it doesn't take that long. Unfortunately, our priorities sometimes are very competing.
Absolutely. We can so often just get lost in the day-to-day. And we recognize that in order for someone to be able to complete this in the way that's most meaningful for them, most likely they're going to need to have some sense of privacy if that's something that they need. So what we have done is to say, we want you to complete this. Here are folks that you can speak to, mentors, peers. If you're looking for some support, we are going to have the environment to kind of discuss and review, but you're also welcome to keep to yourself anything that you'd like. But this is also, I think, getting back to that question of a culture of wellness, where what we're doing by setting this time aside and making this a part of a core experience is to say that we really recognize that this is important, and we value your personal wellness as well as just your professional performance.
Yeah, absolutely. You are definitely setting that as a priority for everyone here. And I personally appreciate that, but I think the average person will also appreciate it once they get into it and they realize how helpful it is for them.
Yeah, I think that's really true. It's been interesting. The way that this is received, I think, varies so widely depending on the audience that I'm speaking to. I find that the students really get this right away.
Oh.
A lot of the faculty, I find we get a sort of blank face at first because these are not really topics, unfortunately, that much of our faculty, particularly our more senior faculty, are used to discussing.
Right.
However, once we actually really get into the WRAP, and everyone is kind of sitting there completing their goals and taking stock and doing their assessment, we end up having really robust conversations following, even with folks who weren't really necessarily so sure to begin with. I think because it is concrete and it is allowing you the opportunity to take something actionable away. And as you say, most of us just go about our day-to-day lives, and particularly those of us who have been on long educational paths. Usually there isn't really a question of, what are our goals outside of career goals or educational goals. And so this is really an opportunity for many folks to be really intentional, perhaps for the first time in a while, about what they are doing in terms of their own personal wellness. And it's amazing. The conversations really take off from that point.
Because the number of people in the health professions who burn so brightly is sort of stunning from when patients learn about that.
Yeah, without question. So this is, we know, a serious epidemic among healthcare professionals now. And I would venture to say again that I think we need to use a broad definition of healthcare professionals, so perhaps not necessarily directly providers, but I think also a lot of our clinical staff. We certainly see that high stress and burnout is a problem there as well. And so I do think that many patients can be very surprised when they hear this. However, the truth is that a provider who is burned out, or a healthcare professional of any kind who is burned out, we know that not only is that a problem for that individual and for their personal life, which is clearly something of great importance and that we are committed to addressing at the GWell Center. But we also know that even though it may be a surprise to our patients, patients in any sort of healthcare environment these days are certainly experiencing the results of burned out healthcare professionals. We know that healthcare professionals who are burned out are less, they are perceived by patients as being less empathic. They are more prone to kind of missing details, perhaps making medical errors. Their patients tend to not be as adherent to the treatment plans that they develop. And patients tend to have poorer health outcomes in that environment. So we know that there are very real implications for patient care. And across the United States, provider burnout, healthcare professional burnout generally, is a very real problem. We know that whether we are in an academic setting or a private practice or a more commercial setting, the rates of provider burnout run right around 30%. So it's substantial.
Yeah, very substantial.
And highly. So it's something that we need to address. And although the evidence here is not as strong, it's very strongly my impression anecdotally that this is not limited just directly to providers, but to folks working in healthcare industry generally.
So how do you get these folks to practice self-care, especially the physicians?
Yeah, so I think the approach varies for everyone. But so one of the things that we know is really important is to provide a variety of resources and tools. Not everyone is going to be into yoga and meditation, and that is fine.
It's true.
So, I happen to enjoy yoga and meditation, but
I do as well. So we're clearly a biased sample.
we are a little bit, I think. But important to recognize that not everyone is into that, and not everyone is even going to be, giving it an opportunity. So we need to make sure that we have a really wide variety of ways that people can engage, and that allows an individual to kind of choose the path that is right for them, and that is a really important piece. Another piece that's really important is making sure that not only are we providing the resources, but that there is actually structurally an opportunity for individuals to engage with those tools and resources. So we can, I remember being an intern and getting an orientation talk about how important sleep was, and that we really needed to make sure that we weren't sleep deprived. And thinking to myself, okay, well, that sounds great, and I appreciate that sleep is important, but if I'm working 30-hour shifts, what am I supposed to be doing about that?
Right. They weren't really setting the culture for that.
Exactly, right. So that's part of the reason why what we're looking at with the GWell Center is also being able to not only provide those resources and tools for individual use, but also to really be able to look at kind of structural issues and questions of leadership and culture. So we do have, as part of the Wellness Advisory Board, a working group that is starting to do an evaluation of the policies and guidelines across the institution, and to create a evidence-based best practices toolkit for leadership, starting with anyone who has any sort of supervisory role. We know that one of the things that is the biggest predictor of burnout in employees is the leadership style of their management and of their direct supervisor. So very often, if a supervisor is able to provide some flexibility wherever possible, instead of having kind of a rigid one-size-fits-all approach, that kind of flexibility can make a really big difference. The opportunity for someone to maybe work from home when they don't need to be physically present, having flexible hours, things of that kind can make a really big difference in allowing people to structure their lives in such a way that they have the opportunity to engage in some of the wellness goals and practices they have identified as being important for them.
Absolutely. So I'm looking forward to hearing more about this at the Sung Symposium. You are one of our speakers. It's April 24th. Mark your calendar now. And
my calendar's marked.
Excellent. I bet it is. Just as a preview, so people can kind of get to know you a little bit better, we know that you're a board certified in preventative medicine and lifestyle medicine, and you like to focus on holistic care with patient empowerment. So how did you get to that point? How did your journey take you there?
Well, it's a little bit of a story. I'll try to make it relatively brief. So my professional journey has not been a direct one. I did not start out as a pre-med in college saying that I wanted to be, chief wellness officer when I grew up. It wasn't a thing that existed even actually until a few years ago, I think. So where I did start out from a young age was being really focused on prevention. I have strong family history of various different non-communicable conditions such as heart disease on both sides of my family. And from a young age, that made a big impact on me. My father had a pretty serious MI when I was young, led to a lot of changes in the way that we did things in our family, and led to a lot of changes in me personally. So I think from a young age, I had a focus on kind of dietary habits. I went vegetarian in 6th grade, originally for ethical issues. I think PETA came in and gave us a presentation, which really had an impact on me, but that was pretty quickly followed by health concerns. I was running track. I began meditating at a young age. I think someone left a copy of the Tao Te Ching laying around my parents' house that I picked up. So these were things that were kind of part of me from a young age. But I think maybe just a reflection of the times in which I was growing up and going through training. Although that preventive care was always a real focus of mine, and for my own self-care, but also when I was in college, I was running an organization where we were doing a lot of homeless outreach. And I think if ever there is a population that will convince you that being able to really address root causes of troubles and being able to address kind of systematic problems is really critical, that's probably a population that will bring you around on that. So preventive care, public health were areas of importance to me for a long time. But when I was in medical school, the fact that I ran was great. Everyone was down with that. The fact that I was vegetarian was, maybe a little bit unusual, but fine. Okay. Meditation is something that you wouldn't even talk about.
Right.
And it's amazing to realize how much that's changed. But at that time, that was
now
really true.
There are apps for that.
Yes. There are apps for that, and we have at the School of Medicine at GW a medical student interest group that is the GW Society of Mindfulness. That would be unheard of when I was going through medical school. And that's a fantastic change. But all of which is to say that it hadn't really occurred to me that preventive medicine was even a thing for me to pursue. I was really interested in working abroad. I was doing a lot of that at the time. A lot of my family's abroad. And I ended up really loving surgery. One way or another, I ended up in ophthalmology. And as a 4th-year resident in ophthalmology, so I was in my final year, I was doing something that I think a lot of us do that will probably sound familiar to folks listening, which was sort of intentionally, consciously putting my self-care on hold for a period of a few months. And it's kind of that, this is going to be happening now, and it's just a few months. And then at the end of that time, I'll be able to kind of pick up my health again sort of mentality, right? And I think, that starts early. We start with, okay, it's Thursday night and all my friends are going out, but I have class Friday morning. So just for tonight, I'm going to go home and be good. And then I'll go to class tomorrow morning. It's just for this weekend. I'm not going to do anything because I'm studying for finals. Or, this month is the month that I'm studying for the MCAT or whatever it is. It starts early. And then we get into training and it's, this is going to be particularly a rough rotation. And so we'll kind of just suck it up and get through it. And then I'll go back to kind of, eating normally and going to the gym and that sort of thing. And so that's kind of where I was, as a surgical senior. I was taking backup call for a week at a time, but that also meant that I was actually taking primary call for a week at a time for some of the locations where our junior residents did not. And, applying for fellowships and developing a program that I was going to be working on in Northern Iraq, where I'd done some of my thesis work for my MPH and kind of, et cetera, all kinds of things. And kind of made a decision that I didn't have time to, really sleep more than a few hours. Meals, certainly not. I was kind of grabbing whatever I could at the hospital.
Pretty common.
Working, absolutely. And
this probably was unhealthy.
So particularly unhealthy because I was in Wisconsin and I was vegetarian.
Oh, yes.
And so that meant like mac and cheese, cream of broccoli, pizza. Not fantastic. And that was when I got to have a meal. And working out was certainly not happening. And so all of those things combined, kind of at the end of those few months, I went for a little run, and ended up having my patella, my kneecap dislocate.
Oh,
yeah, so that's not awesome. But it's like, a 6-week injury usually. But I was in my final year of residency, and I continued to take call on crutches and keep a full schedule, and, going into the OR, operating with like a bag of ice strapped to my knee, and doing all of these things that were really just pushing through instead of actually addressing what my body needed, because that was the culture, and that was what I think rightly I thought was expected of me. And what ended up happening was that it didn't get better, and it kept getting worse. And I started developing all these strange symptoms that the physician I was seeing couldn't really explain, like huge pitting edema and really, really intense pain that was much worse than it happened when it first started, and really strange things. And the edema was so huge to the point that in ophthalmology, we take our shoes off when operating. And the fellow that I was working with on one case, actually, he was so alarmed that he made me go to the emergency room because he thought that I had a DVT.
Oh, wow.
So it was significant. We didn't really know what was happening. And I kind of just kept going on it. And it was about 3 months before I saw someone new who gave me a diagnosis that this was a sympathetic nerve dystrophy. And at that point, what I was told was that they weren't sure I was going to be able to walk again. But that it was going to take some pretty intensive physical therapy and a lot of nerve blocks and kind of throwing the kitchen sink at it. And so that ended up meaning that I wasn't, for a period of time, I was trying to be both a patient and a resident, and it didn't really work. And what it ended up meaning was that I needed to take time to really focus on getting better. And so we did the kitchen sink. And, but I also, one of the things that I became aware of, and something that became really clear in the reading that I did at that time, because it wasn't really a condition I was familiar with, was that as a profession, we in medicine actually still don't really understand an awful lot about how sympathetic nerve dystrophies work and how to address them, which is why we were taking the kitchen sink approach. And I ended up saying to myself, you know what, I can see that part of what went wrong here was that I've had all of these aspects of my life and my self-care that I've been engaging with from such a young age, and I kind of allowed all of that to go out the window. And so I made a big point of getting back into all the things that I knew were working for me. But then on top of that, really diving deeper and doing a lot of research into, what does an anti-inflammatory lifestyle look like? What does an anti-inflammatory diet look like? What is the actual evidence here that's going to be useful? So that I'm not just kind of going off of someone's blog, but really understanding what is the kind of pathophysiology, the biology behind these approaches that I'm taking. And I have to say that it was a process, but I was able to get better. And that was after the nerve blocks had stopped working. I really believe that this was a huge part of what made it possible for me to recover, to the point that a few years ago I was able to start very slowly and pathetically, but to start running again.
Well, that's great.
And so, yes, I was very excited. Don't get me wrong. You'd be able to walk briskly past me.
That's all right.
But so this, I think, really kind of brought me back to the roots of what had been a really important approach to my own health, but also to patient health for a really long time. When I was in ophthalmology, my intention was to be focusing on prevention. So I was applying in glaucoma and ocular epidemiology and working on kind of rapid assessments of avoidable blindness. And so this brought me to the opportunity to say, I really think that this is something that is critical in healthcare that is so frequently overlooked and really missing, both in the care that we provide to our patients, but also in the way that we really think about the culture of working in healthcare. And so at that point, it made perfect sense for my next step to go into a second residency in preventive medicine. At that point, I already had my MPH. And so that allowed me an opportunity that's usually part of a preventive medicine training program. Since I already had that, it allowed me the opportunity to kind of create a little bit more of a curriculum for myself. So I knew that these aspects of a healthful lifestyle were really important to what I wanted to be doing with my future career. And at that time, there wasn't such a thing as a lifestyle medicine residency program or training track, but I was able to kind of create one for myself. And so that led me to a place of telling my program director that I was interested in starting a resident-run clinic where we would take this kind of approach with our patients. And she kind of said to me, "Okay, sure, whatever, that sounds fine." And so I was able to start doing that as a resident. And when I was looking to institutions where I might be able to continue this as faculty, I found the opportunity to do that here at GW and start our program here in lifestyle medicine, which is now come so far that it is actually a board certified specialty.
Well, I think that is the perfect ending. You've given us a lot to think on, and it's an excellent teaser for your talk for the Sung Symposium, which I hope everyone will tune into remotely or come to DC and attend in person, hopefully. Thank you so much for joining us, Kaylan. I really enjoyed it.
It was really my pleasure. Thank you both so much for inviting me. And I'm also looking forward to the Sung Symposium in April.
This is the GW Integrative Medicine podcast from the GW Office of Integrative Medicine and Health.
I'm Dr. Lee Frame.
And I'm Janet Rodriguez.
Thanks for listening.